Okay, so I am a toxicologist. I'm from the medical school with an affiliate position here in the College of Global Health. And my toxicology focuses really in the areas of inhalation toxicology and developmental toxicology. And I thank Pam for bringing up and setting a baseline for some of the things that I'll be talking about in terms of climate change. And so, this one, thank you. Okay, so I also like to walk, and what's the genetic thing here?
This might help.
Oh, okay. Oh, now I have two hands. Okay, so as you can see, we've talked about, which is why I asked Jack if I could go last, because it's kind of a summary slide here, showing you some of the things that we've talked about here in terms of climate change, the warmer temperatures, the increased rainfall, how you get disruptions of the ecosystem that was talked about by Andrea. That also leads to wildfires and more, and as we've heard this whole morning, the spread of disease-carrying insects, and also disruptions to societal systems, and you've heard about psychosocial stressors, changes in tourism, things that actually bring about stress, and that how the climate change can actually work with all of these things and bring about mental health illness. So one of the things, and Jack pointed it out when he introduced it, is we need to think about how that all comes together in terms of human health. And you've heard about the illnesses and the infections that could arise, and some of the mental health issues that can arise. But let's talk about the actual human health and the toxicological role in some of these human health outcomes associated with climate change. And to even go one step further, you've heard all throughout the day today that there are vulnerable populations. And one of the major groups, besides those with ongoing cardiovascular disease or hypertension or any kind of metabolic disorder disease, we have the elderly, and of course we have pregnant women, the unborn fetus, and then of course the neonate. And those are especially vulnerable populations. So how is climate change going to affect them? So it's not just me thinking this is an important issue, but the EPA came out in 2016 with a document. Here's the website. Showing that there is a fear, which is supported by many human studies and a lot of animal studies, that there is this fear that changes in increasing temperature and climate change in general, leading to increased air pollution, decreased safe drinking, changes in nutrition, can all have impacts on the pregnant woman, their unborn child, and their child, the neonate. Oops. Up. Okay. So, being the inhalation toxicologist that I am, one of the big things that we could expect to see with climate change is an increase in air pollution. So we know New York City is now a lot better than it once was. And hopefully getting better with a lot of changes that are going on. But when you have air pollutants such as NOx, and you have smog, and you have particulate matter, PM10, PM 2.5, meaning the fine particles. So if you increase the heat, you get a lot of secondary pollutions. You also secondary air pollutants that include things like ozone. And then you get all of these sources of these air pollution that can get worse and when you heat up the climate, you get more wildfires, and we've certainly seen a lot of that in California. And these are going to pollute toxic chemicals, also from cars, trucks, etc. And these are greenhouse gases. So air pollution is going to be greatly affected by climate change. And here are some of the other outcomes one could expect. Carbon dioxide, which contributes to global climate change, even though in some ways it's a good thing. You get lots of sulfur dioxide. These are all air pollutants contributing to smog. And if anybody's flown over Los Angeles in a plane, you can say, oh, there's a house down there. Because sometimes you'll see this big LA dark cloud or covering. If you fly into Beijing, it's the same thing. And if you look down at Newark Airport over Elizabeth, you may see it too. So oil spills, runoff, pollution, a lot of coal-fired power plants, and they release a lot of harmful toxicants, including lead and arsenic. And I don't have to go into detail about those toxicants. So arsenic, but remember we're bringing this back to pregnancy and human health. So arsenic is, as you can see, is very common throughout the United States from a geological perspective, and it's also found in dust out in California, and I've unfortunately driven through this. So there are dust storms which bear arsenic on it, and many studies have been done which show that exposure to arsenic or increased levels of arsenic is associated with low birth weight, neonatal infections, and changes in essential genes for development. So what about these air pollutants? The increase in coal, increase in ozone, increase in NO2, nitric oxide, increase in many of these air pollutants. Well, we know from both human and or animal studies that air pollution poses a great risk for pregnant women and for the fetus. High blood pressure, which can lead to total adverse outcome, miscarriages, stillbirths, early birth, okay, hypertension, poor brain development. So air pollutants are linked with either immediate outcomes associated with birth, like low birth weight or preterm delivery, or later outcomes in the children, because as you'll see in a minute, in utero is a very sensitive and vulnerable position to be in. And many toxicants cross through the placenta very readily, and the fetus tends to act like a sink. Also, you've heard everything that goes up in the air has to come down. And so dioxin's a very well-known carcinogen. And for those of you who might be a little bit older, although I don't see older people in the audience, you might remember Vietnam, and you might remember Agent Orange, and that was thought of as going to be a great defoliant. Unfortunately, it had pollutants and contaminants associated with it, like dioxin, and we're working with communities who live near the Passaic River because that's exactly where the company dumped all the Agent Orange. So dioxin is a carcinogen, and if it goes up from wildfires or from air pollution, it's going to come down, and you saw this when Andrea described it as well as Pam. It's going to come out into the water and contaminate it. Also, polycyclic aromatic hydrocarbons. You may like these when if you like your steak well done on a barbecue. That well done stuff that gives it all that flavor is actually polycyclic aromatic hydrocarbons. They are carcinogens. They also come out in very large amounts in wildfires, and it goes up into the air and then comes back down into the runoff and into the rivers. So why are these a problem? Why are things like dioxin, PCBs, again, keeping it in line with the effects? These are called persistent organic pollutants, or POPs, and that I've just described, like PAHs, and you heard about PCBs, and I also mentioned dioxins. Well, at higher levels or during exposure during pregnancy, it can grossly affect the fetus and the baby. Low birth weight, and low birth weight gives rise to a lot of chronic diseases later in life that are associated with it, like asthma and obesity, decreased IQ, chromosomal abnormalities, and how about later life cancers? There seems to be an association between some of these exposures early on and later life diseases. And in the mom, she's not going to escape either. So these chemicals are associated with endocrine abnormalities, hormone production, and cancer as well. So as you can see, many of the chemicals that are, the toxicants that are associated with climate change and increasing these chemicals can have a dramatic effect on this vulnerable population. So I just wanted to tell you there are things that I couldn't go over. Jack is a very strict taskmaster, so you have this much time. So I just wanted to end and show you some things that are also associated, apparently I can't spell very well, but that are also very much associated with climate change. So climate change, temperature, nutrition, can all lead to a compromise of the immune response. And you know that any kind of compromise of the immune response can lead to increased infections and increased cancer. And you've heard all about the infections this morning. So imagine if your immune system is compromised in that regard. Genetics, the things that you've heard about, the changes in nutrition, the heat, the increased UV radiation, many of these chemicals, the coal burning, the metals, the lead, the arsenic, are associated with in utero changes in the genetics, in the DNA. Growth factors. So in utero, you're very susceptible to things, and the things that make you grow to a certain weight and height and size helps your placenta develop, help you develop as an individual. Those can also be affected by many of the chemicals and many of the conditions that you've just heard. Epigenetics, the in utero situation, the fetus is in a very vulnerable position. And it's programmed to survive, and it's programmed to have organogenesis. Your epigenetics, those mechanisms that actually control the expression of the genes, if they're changed, then you are reprogrammed. And of course, autoimmunity. If you affect the immune system in such a way that your immune response is prohibited or compromised, then you're going to have increased susceptibility to infections and cancer. However, the other way an adverse immune response can form an outcome is to be hyperactivated. So anyone with allergies in here, type 1 hypersensitivity, or any type of autoimmune disease is associated with a hyperreactivity of your immune system. So things like lupus and multiple sclerosis are associated with autoimmunity. So when the fetus is exposed to some of these chemicals and the immune system goes awry, autoimmunity can result in programming during later life. So I just wanted to say thank you, and Jack said to always end on a high note, so we will survive.